I'd already been to the doctor saying I feel very weak, I don't know what the matter is, and they said, well, you've had such a shock, it probably is shock coming out, but if you're not better, come back in 2 weeks. So my wife, being as she is, left it 3 weeks, and then so this happened. So she went down to the doctor's the next day, and the doctor said, well, there's obviously something wrong, I'll do some blood tests. And the blood tests were examined immediately. I was amazed. 6 o'clock that evening, she got a phone call from the Royal. You need to come in to the haematology unit immediately. Your blood levels are dangerously low. So a lady from church took us in, and she says, what's the matter? Well, it's probably just a bit anemic. You probably just need a blood transfusion, that's all. Not knowing what was to come. And we got told she got leukemia. Immediately it hit me. There's no 2 hour gap there, and I was like, inside I was screaming, what are you doing, God? What are you doing? It's bad enough I've got a brain. Now Cass got leukemia. One of us is going to die. I really felt it was her, because I was feeling a lot better at that stage. So how can I trust you ever again? I can't believe this is happening. It felt like a tragedy movie from Hollywood. I've got a brain tumour. She's now at the same time got leukemia. What is happening? And I really, really felt awful. I didn't show it in front of my wife, because I thought, well, I've got to be strong for her. Inside, I was really crying at her, but she pulled through. Thank God. And she's now been discharged. She came out of hospital in July after I'd had a scan. About saying so both at the same time. We got told both of us were in remission. So thank you, God, and we went home together, and that was absolutely wonderful. To be home together and well was absolutely marvellous.
So you were back to having a period where you were both back to normal
selves. That's it. But I've missed out a bit, because for 6 weeks during the 6 months she was in, I was going in as an outpatient to have my radio and chemotherapy. Now, the chemotherapy, I have to say, it was tablets. It was, never mind the name of the tablet, but it didn't really, perhaps because I was on the radiotherapy, I didn't feel any ill effects really from this chemotherapy tablet, except that my food tasted absolutely foul. Everything tasted like, if you can imagine, metallic cardboard. Awful. Food I enjoyed, I hated. Food that I didn't enjoy, I was eating, because at least it tasted of something different. So I don't like spicy things. I'll be putting pepper on everything, because at least it tasted of pepper. Even though I didn't like pepper, it tasted of something.
What about if the food was really neutral? Would it still taste bad?
Yeah, everything. I loved chocolate, couldn't eat it because it tasted so foul. My favourite dish, simple dish, was egg and beans on toast. Tasted foul. I'd put pepper on it, and there was no point in eating anything I enjoyed, because I just had to eat nutritious food so that I was strong. I knew that.
Was that a side effect that went along with the chemotherapy?
Yes, absolutely. Yeah. As soon as I finished the chemo, within about 2 weeks, my food taste went back to normal. So I'd lost a lot of weight, as you can imagine. So I didn't care how much chocolate I ate.
So you had about six weeks of additional treatment.
Yeah, and the radiotherapy was the worst, because it was every Monday to Friday for 6 weeks. Now, when it first, of course, it's your brain as well. It's not like it's to your foot, so your foot feels bad. For the first 2 weeks, I didn't really notice any symptoms. After that, I noticed I was feeling more and more tired. And after about the 5th week, so I've got 2 weeks to go, I was absolutely shattered. All I could do was get up in the morning, have some. You got to be sensible and keep yourself strong. Have some breakfast with a cup of tea, and it didn't taste nice, but you got to do it. I went and lay down on the sofa because I didn't want to go back to bed, and I'd lie there watching telly till it was dinner time. Get up, make myself a couple of sandwiches and a drink, back down watching telly again.
During that tiredness phase, if you forced yourself to do something exertional, did it make it worse, or did you feel better for it?
I think psychologically I felt better for doing something. Physically, it was like, my legs are so tired, I've got to go and lie down or sit down. Sometimes I just had to sit down, sometimes it was lying down.
Was it almost like a different type of tiredness to the tiredness you'd experienced before?
It was like having flu. How shattered you feel when you've got flu. That's what it felt like, but I've got no flu symptoms. But really, really shattered, yeah.
And how long did that go on for, the tiredness?
Well, from about the 5th week, And the 6th week, it was like that. But of course, I was having to be picked up by ambulance to go in to have me radiotherapy and come out again. As soon as I got home, if it was dinner time, maybe get myself something to eat and straight back on the sofa to sleep. And then gradually, after the 6th week, I gradually started feeling slowly better. So I got more energy. I didn't have to go and lie down for such a long time. I might have to lie down for an hour only, But then after 6 weeks, so 6 weeks after the last radiotherapy treatment, I felt so, only a few days earlier, I felt so much better. So I got up as normal. I guess it was Monday morning. Made myself breakfast. I didn't have to go into hospital. I was thinking, great, I can do what I want today. I still feel shattered, but no, I don't feel so shattered because it's been 6 weeks later. I can do some gardening. I thought, I had my breakfast. I thought, I'm not going to do the gardening yet because I've got to let it go down. Sat on the sofa, and suddenly this massive wave of tiredness just hit me. I just had to lie down and go to sleep. When I woke up, I thought, this isn't right. So I rang my cancer specialist nurse, Audrey Hopwood, lovely lady. I said, something's the matter. I said, it's been 6 weeks since the treatment. I've been feeling so much better. And suddenly this awful tiredness, this absolute shattering tiredness has hit me. And she said, did you say 6 weeks after? I said, yeah. She says, that's normal. I said, why didn't somebody tell you? I said, I was really worried. I thought, I was going to, have to go back in hospital again. Why don't they, if they know it's going to happen, they should tell you. Oh, don't forget, in 6 weeks after the treatment, you'll probably, most likely, feel absolutely shattered again. So for 2 weeks, I was back to how I was when I was on the radiotherapy. Then I had to go in for a scan, and the scan bloke had been the same chap that I'd seen every time before. And I said, how are you, Chris? I said, I'm all right, mate. But I said, a couple of weeks ago, this dreadful tiredness hit me out of the blue. He said, was it 6 weeks after the treatment? So even he knew. It's so annoying. Why don't these, experts tell you this is likely to happen? Because it'll stop you worrying. So that happened again, but after 2 weeks, I gradually felt better and better, stronger and stronger, and was just doing more things,
So how long would you say it took until you were really back to, let's say, 90% or more?
Probably about, so after I finished the whole treatment, probably a couple of months.
Was there anything you couldn't do after that period? Because you mentioned before about driving and
yes, that's right. I was certainly not allowed to drive and not ride my motorbike. I was riding my bicycle because I knew, I wasn't really strong enough to walk far, so biking was a lot easier. So I started cycling. A bit wobbly at first, but soon got okay. Yeah, I couldn't play a game of football. I couldn't do anything, or tennis. I couldn't run because I was still too weak. But I didn't really worry about that. I thought, well, that'll come back in time. I got my legs had gone sparrow legs. All muscle wastage was incredible because I'd just been lying on the sofa, and such like. So I knew I needed to eat good food, eat well, eat healthily, and I used to try and do little walks. So I just walk down the road 100 yards, if that, and back, and try and increase it every day if possible.
So you almost did your own kind of rehabilitation program?
Yes. Did
you ever receive any advice there?
I did, but only because I went back to my GP, because my ankles were absolute agony when I got out of bed in the morning. It was so painful, I just sometimes collapsed on the floor. Absolute agony. And I went back and he said, you've got plantar fasciitis. You probably know is a shortening of the hamstrings because you're laid up for so long, you're not walking. Cycling didn't help because you don't stretch your legs properly. So he told me I was going to send you for some 6 weeks of physio at Loughborough Hospital, which was great. And the chap there was brilliant. He was I can't remember his name now, Asian chap called Jed or Jez or something, but he was absolutely brilliant. He seemed to know what was the matter with me within about an hour of me seeing him. Right, these are the exercises that are going to help, and they really did. They really did help. But again, if I hadn't gone to my GP, I suppose you've got to complain, haven't you? If they don't think there's anything wrong, they're not going to come to you. I'm sure if Julie had come to me, my specialist, Loris nurse, she could have got something going, but as far as I can remember, they didn't. It was me having to say, I've got a real problem here, you know.
Let's say that you were a person who was post-operative, you had your treatment and you were going through that rehabilitation phase, but there wasn't really any clear person around who you could ask.
Yeah.
Is there anything you could have done for yourself in retrospect in that time, going back from the moment the chemotherapy and radiotherapy finished?
Yeah.
I mean, for example, would you advise people to push themselves, you know, to do more, even though it's a real struggle in that early
No,
period?
I think I'd advise them to rest as much as possible, eat healthily and rest as much as possible, because, you know, it just wasn't possible to...
Until they're able.
Until they're able. Once they start feeling able, yes, go for a little walk. It's better for your mental health as well. Get yourself out of the house just a little, or go and have a cup of tea with a neighbour if you can. You know, just to get you out, a little tiny bit of walking. You know, well, everybody's individual. Maybe some people wouldn't have a problem with walking. I guess it depends where the tumour is, of course. If it's a brain tumour, then you're likely to. And of course, it depends where the tumour is in the brain. Because it wasn't until I had the brain tumour I didn't realise there's something like over 100 different types of brain tumour. So it depends on what type of tumour, where it is, how much chemotherapy and radiotherapy you have, what type.